Shortness of breath is a common symptom that many people experience under various circumstances. This feeling can be uncomfortable and even anxiety-inducing, especially if it happens suddenly or under unusual conditions. In this article, we will explore the causes of shortness of breath, its symptoms, diagnosis, treatment options, and preventive measures. What is shortness of breath? Shortness of breath, also known as dyspnea, refers to the feeling of not being able to breathe normally or the sensation of not getting enough air. This could be caused by a health issue or environmental factors such as strenuous physical activity or changes in temperature. In cases where shortness of breath occurs unexpectedly or in unfamiliar settings, it may indicate an underlying health problem that requires medical attention. Causes of shortness of breath. 1. Acute causes. Sudden shortness of breath can be linked to several health conditions, some of which may be life-threatening, including anaphylaxis, triggered by allergens such as pollen, food, or medications.
Asthma.
A chronic condition causing the airways to constrict and making breathing difficult. Carbon monoxide poisoning. Exposure to carbon monoxide can prevent the body from receiving oxygen, leading to shortness of breath. COVID-19 can lead to difficulty breathing, particularly in severe cases. Heart attack can cause sudden shortness of breath due to the heart's inability to pump blood effectively. Pulmonary embolism, a blood clot in the lungs, can block blood flow, resulting in shortness of breath. 2. Chronic causes. Chronic shortness of breath may occur due to long-standing health conditions, such as chronic obstructive pulmonary disease, a long-term lung disease that causes difficulty breathing. Chronic asthma leads to ongoing breathing difficulties. Obesity. Extra weight can put pressure on the respiratory system, making it harder to breathe. Pneumonia, an infection that inflames the lungs and causes difficulty breathing. 3. Other causes. Other factors that can contribute to shortness of breath include heart failure. The heart cannot pump blood efficiently, which leads to fluid buildup in the lungs. Pericarditis. Inflammation of the membranes surrounding the heart. Pulmonary hypertension. High blood pressure in the arteries of the lungs. Anemia can reduce oxygen levels in the body, leading to shortness of breath. Symptoms of shortness of breath. 1. Acute symptoms: chest pain or discomfort. Rapid breathing. Difficulty speaking or moving due to the inability to breathe properly. Dizziness or fainting. Changes in skin color, such as blue lips or nails. 2. Chronic symptoms. Swelling in the feet and ankles, often seen in chronic cases. Difficulty breathing while lying down. People may notice they can breathe easily while in a reclined position. Wheezing, a high-pitched sound when breathing. Diagnosis and treatment. 1. Diagnosis. Diagnosis is typically made based on the patient's clinical examination and medical history. Additional tests may include chest X-ray to view the lungs and heart, pulmonary function tests to assess lung capacity and airflow, blood tests to measure oxygen levels in the blood. 2. Treatment. The treatment for shortness of breath depends on the underlying cause. It may include medications, such as bronchodilators or heart failure medications. Supplemental oxygen, if blood oxygen levels are low. Physical therapy, to improve breathing techniques. Surgical procedures, for conditions like blood clot removal or lung surgery. First aid for sudden shortness of breath. Stay calm. It is crucial to remain calm, as anxiety can worsen breathing difficulties. Sit in a comfortable position. Sitting upright or standing can help improve airflow. Call emergency services. If shortness of breath is severe or accompanied by chest pain or loss of consciousness, seek immediate medical attention. Prevention and preventive measures to prevent worsening of shortness of breath. Consider the following preventive steps. Quit smoking. Helps reduce the risk of respiratory diseases. Avoid environmental triggers, such as smoke or chemical fumes. Maintain a healthy weight. Helps reduce pressure on the respiratory system. Exercise regularly. Improves overall fitness and lung capacity. When to see a doctor, seek medical attention if you experience sudden and unexplained shortness of breath. You feel chest pain along with shortness of breath. Your skin turns a bluish color. New symptoms develop or existing symptoms worsen. Conclusion. Shortness of breath is a symptom that can range from being a minor inconvenience to a serious medical emergency.
Wow.
It is important to understand the potential causes of this condition and seek appropriate treatment based on its origin. In cases of chronic shortness of breath, managing underlying health conditions and following preventive measures can significantly improve quality of life and reduce the risk of complications.